now. Well, good morning, everyone. I'm Assemblymember Freddie Rodriguez, and I want to begin by thanking all of you for engaging in this important town hall this morning. COVID-19 has brought forward much uncertainty, and I know that there are many constituents with questions on how we are combating this pandemic and how to receive information and assistance during this troubling time. Joining us today on our call are local healthcare professionals and small business leaders who have been working hard at the front lines of this pandemic. They will provide you with important COVID-19 information and updates and help connect you with the appropriate people for further assistance. This includes my office, which will still remain open electronically. Before I introduce our panelists, I would like to take a moment to share a few updates on the actions the legislature has taken to address COVID-19. Last month, $1 billion was approved by the state to help fight the virus and care for residents. This money included opening 2 additional hospitals to handle the capacity surge, provide housing for homeless individuals, and get life-saving equipment to areas that need it. We continue to stay engaged with local leaders and our residents. I know I have heard from many of you, and we will do our best to address your questions and concerns. Several folks have mentioned they have applied for EDD, Employment Development Assistance, and my office is here to assist you. Because we're currently under a state of emergency, a stay-at-home order has been placed in all counties. This stay-at-home order is meant to help California flatten the curve of COVID-19. This means that many businesses had to adjust their hours or postpone their services. As a result, Governor Newsom has announced a new task force on business and jobs recovery. The task force will work to develop actions government and businesses can take to help Californians recover as fast and as safely as possible from the COVID-19 induced recession. In addition, the California Small Business Loan Guarantee Program via iBank is now making available $50 million in state funding, providing potential capital for individuals who do not qualify for federal funds. The U.S. Small Business Administration, SBA, is now declared all California counties eligible for the economic injury disaster loans. This means that SBA loans can be approved for up to $2 million, but are limited to the economic injury determined by SBA. These loans are intended to assist through the disaster recovery period. Both the state and the federal government are working tirelessly to make sure we're providing as much relief for Americans. Recently, Congress and the President agreed on several major economic stimulus and relief packages as the country deals with this pandemic. In the 52nd Assembly District, I have heard from many residents who have received some benefits and many who are still looking for information and resources. The Federal Families First Coronavirus Response Act, approved at the end of May, allows for funds to be spent on paid emergency leave and food assistance for people. I know this has helped many residents who are facing reduced work hours or who are completely laid off. Today we will be hearing more about programs like the unemployment insurance and how the state is working hard to meet its demand. Now we will hear from our panelists. First, we will hear from the chair of the San Bernardino County Workforce Development Board, Philip Cothran, and director of the Workforce Development Department, Sandy Harmsman. So with that, Mr. Cothran and Ms. Harmon, you can go ahead.
Yeah. Good morning, Mr. Lerman. We appreciate you having San Bernardino County Workforce Board on your talk, and we hope that we can give you some information for your constituents. You understand that I'm chairman of the Workforce Board for the county. We're a private group of business folks that are appointed by the County Board of Supervisors, and we administrate the federal funds under the WIOA Act. So we take care of both sides of the house, both of the job recipient and the business side. So let me start with a couple of the things that we have to offer as far as the job seekers are concerned. And that is, we have our 3 job centers. We call them the American Job Centers. You'll find one of them very, very close to your district in the city of Rancho Cucamonga. We have one in San Bernardino, and then we have one in the high desert to serve those folks. So that's where the particular job seeker would come. We're looking at their job skills, doing some assessments for them, identifying their career path, updating simple things like their resume, preparing them for a job interview, and finding training programs so that if they find themselves where they're not going back to work at the same place that they may have been laid off on, maybe it's a career change, maybe that's a different type of life, and they need some training for that, then we have those funds and resources available to do that. And I'll give you some the website and how to make connection with those. On the other side of the house, we take care of our employers, because if we don't have a strong workforce, we don't have strong employers, then we don't have places for people to work. So we get to divide both of those, and we have a whole division of our department that takes care of the businesses that we deal with on a day-to-day basis. You know that obviously we were hit hardest in our retail, in our entertainment, and our hospitality industries, to where, you know, we're going to see unemployment in excess of 30% in those. So even though that might be a doom and gloom, we expect this to be very sharp and very responsive in our nature to get people back to work. And that's what will make this all come back together again. We have focused for the last month. We know that there was a great deal of issues and a great deal of things that people were having to deal with and making changes when businesses shut down. But we started talking about recovery from day one, because if we don't have a positive attitude and the workforce doesn't step up, I mean, it's our job to make sure that people are ready to go back to work and businesses are ready to have those people come back to work. So on the business side, of course, we've been obviously given all of our businesses the federal and state resources that are out there that have come back, and several of those programs. But internally, we have a staff that are able to meet the needs of our businesses by a rapid response program, like an on-site assessment of what's happening for companies and how to get them, how to remarket themselves, and oftentimes how to deal with people working remotely that they've never had to deal with in the past. We have a layoff aversion program that tells them to operate more efficiently so that they can minimize the people that are being laid off. And then, of course, we have an HR hotline that is, all of these things are free for our employers. Our HR hotline gives them any kind of information they may need in the HR issue, and that seems to be tremendously helpful. So we've got a wonderful tool bag to help both the people in your district that are needing a job or needing to go back to work or needing to upgrade their skills, and for those companies that are in your district that may need some assistance in finding themselves in a whole new work arena. So if you, I know on our website it's sbcounty.gov/workforce. That's sbcounty.gov/workforce. All of the things that we do and can talk about and can be a great help to your constituents are on that website. We appreciate what you're doing and for you taking a lead in this.
Well, thank you for your update and for everything the board and the WDD are doing to support workers and businesses in San Bernardino County. With that, we'll be asking you some questions once we hear from each speaker. Next, we will hear from Dr. Javier Sanchez. Dr. Sanchez is a family medicine physician with Kaiser Permanente in Redlands. He's also the executive officer to the San Bernardino County Medical Society and faculty at UCR Riverside School of Medicine. Dr. Sanchez.
Well, Assemblyman Rodriguez, thank you very much for inviting me to participate in the town hall. I just wanted to give you an overview of what's going on here at the county. The shelter-in-place orders have worked quite well here at the county. We haven't had any major surge of the COVID-19. As of this morning, the county has performed 19,964 tests. We have 156 confirmed positive cases. We have 123 suspected cases. We have a 250 surge capacity beds in use, with still over 1,000 surge capacity beds available. In the ICU, we have 51 positive cases with 31 suspected cases, and we still have 179 ICU beds available. Testing-wise, in the county here, So yesterday, we're testing anybody over 65 that wants to get tested. There's different facilities in different areas in the county where you can get tested. If you want more information about testing facilities, you can go to sbcovid19.com, and you can get all the information about testing facilities and all the latest numbers here at the county. In terms of reopening the healthcare system, both the Governor of California and the California Medical Association are working on a four-step approach. The first one is we want to make sure that we have universal safety protocols at any facility that's providing health care. We want to have a phased approach based on local circumstances. So if we have any hot areas, then we want to minimize the exposure at that place. We want to make sure we have special care to our vulnerable populations, and we want to prioritize delayed care. The other thing we want to do is we want to make sure as the stay-at-home orders are relaxed, we want to make sure that people continue to work on social distancing, on washing their hands, and face covering. We want to make sure that people continue to eat well, eat healthy. We do recommend for people to try to do a lot of meditation, a lot of relaxation, to really try to overcome a lot of this anxiety that has come because of COVID-19. I'll be happy to answer any other questions or any other concerns you have.
Thank you, Dr. Sanchez, for that information and for the help to protect our families during this difficult time. At this time, we'll also hear from our Capital Director, Sean Connolly, who will provide an update regarding the unemployment. Sean.
Thank you, Assemblymember Rodriguez and those on the line today. We understand the current pandemic has impacted many people across this district, and we are here to help you. The Employment Development Department has received over 3 million unemployment insurance applications since March 12th alone, and has disbursed more than $3 billion in unemployment insurance since March 15th. Beginning March 29th, the Federal CARES Act extended unemployment benefits by 13 weeks to those who exhausted their claims this year. An additional $600 of unemployment benefit per week became effective on April 11th, giving beneficiaries additional assistance during this difficult time. We understand that there are a number of unemployment applications that have gone unprocessed. EDD has hired new staff and is diverting existing staff to process these requests. Hours have also been expanded to evenings and weekends. We know EDD is working to reduce those wait times. We will continue to hold them accountable and assist residents as needed. If you file online, it will take approximately 3 weeks to process an application. If you mail in your application, it will take longer. We encourage you all to file online at www.edd.ca.gov. As of April 28th, the state began processing claims for business owners, independent contractors, self-employed, freelance, and gig economy workers affected by COVID-19 under the Pandemic Unemployment Assistance Program. If you are unable to work due to having COVID-19 or being exposed to novel coronavirus, you can get medical documentation from your doctor and apply for disability insurance as well. For fastest processing, again, EDD recommends submitting those claims online. If you're unable to work because you're caring for an ill family member or quarantined with them with COVID-19, you can file a paid family leave claim, which provides up to 6 weeks of leave. Beginning July 1st, this benefit will be provided for up to 8 weeks. We understand that during this uncertain time, this is where you may be looking for help. Please reach out to our district office, and we can try and assist you. Thank you very much, Assemblymember Rodriguez.
Thank you, Sean, and a big thank you to all the panelists for participating and providing us such great information during this difficult time. With the time we have left, we will answer some of the questions that have been sent in by residents. We don't have enough time, so I apologize if we don't get to your question. We will do our best to get as many questions as possible. So with that, one of the first questions that was brought to me was, will the legislature be writing a bill to deal with the nursing home industry to help reduce the high number of COVID-19 infections and deaths statewide? Thank you for that important question. The problems revolving around nursing homes are of great concern to me, and I look forward to working with my colleagues in the legislature to fix those problems and protect the residents and employees of the California nursing homes. So that is something we'll be looking at. One of the other questions that was posed to me, how much longer are we going to be stuck at home and not allowed to use parks and recreational facilities? With that, as Governor Newsom said earlier this week, the state is developing a plan to reopen the economy in a series of phases. We are currently in the first phase, which is staying at home and continuing the efforts to flatten the curve. The state will continue developing a plan to reopen the economy based on facts and data. In the meantime, it is important that we continue to do our part to help flatten the curve by practicing social distancing and protecting the public health of our state. And now for our panelists, for some other questions that were brought to our attention. One of them was, what can small businesses do if their business has slowed or shut down due to COVID? Can any of the panelists address that answer or question?
Sandy, that's probably, that might be a detailed question that you could jump in on.
Okay, excellent. Okay, I wasn't sure if Phil was going to answer or not. Thank you for that question. So as Phil had mentioned earlier, Assemblyman, we have a business services team, and Phil gave out our website information. There are phone numbers there that they can reach out. They can either email us or they can reach out through those phone numbers. And we have business services representatives who are currently serving businesses as we speak. They are all available by phone. They have been able to provide support as far as OJT dollars. If someone is looking to add staff, we actually have businesses who are hiring right now, and we've been working with them on assisting them with financial assistance to our OJT program. We also have, as Phil had mentioned, the consultants and our HR hotline. A lot of resources to connect them to, and the business services rep can directly connect them to those resources. I also wanted to add that the county has put together a recovery team that has included a lot of our departments in the county, our leaders in business, including our workforce board members, and they are working on resources and assistance for those businesses as they open as well. So we are here ready to support them as they reach out to us.
With that said, is there? I know you mentioned the phone numbers and a website. Do you have the phone number of the website that you can just announce as well to the folks that are listening? Maybe they can jot it down in case they may not know of that phone number or website. If you have it handy there.
Yeah, you know what? I'm looking it up right now. Phil, I know Phil.
I've got the website.
Yeah. Can you go?
The website is SB County, so it's SBCOUNTY.gov, G-O-V, with a / workforce, WORKFORCE. And they could go onto that website, of course. I'm not sure, Sandy, if you've got one of our direct lines.
And then what will happen, Assembly Member, is that depending on the area that they're in, as Phil had mentioned, we have 3 offices. So depending on the area that the person is in, then it will direct them. The website will direct them to which one to call to connect. Okay,
that's great. And just another question that was posed to me, kind of similar. Maybe you have answered it. So it says, what local resources are currently available to small businesses? And for 2, is there any assistance for nonprofits?
Yes, nonprofits. So I'm going to go. I jumped in. Yes, absolutely. Nonprofits can connect with us and receive services as well. And again, in conjunction with them, what I didn't mention, I'm glad you asked that second question, because we also work very, very closely with our economic development department. So we have folks that are working in that department that provide direct services who are closely tied to the Small Business Administration. So we work with economic development with that side of the house and the needs of employers from that perspective. and then again from workforce development, the business services representatives that we have are there ready to answer whatever questions that employers may have. One very interesting thing, Assembly Member, we've been working on at the direction of our workforce board, a questionnaire, and thus far we have received over 400 responses to this questionnaire that ask specifically what small businesses need during this time. And we are currently putting together, and you'll see this on the website, we have webinars, we have workshops that have been tailored specifically to what the employers have told us that they need. As soon as we get the responses from the employers and they say, we need information about how to help my employees if I have to cut their hours, what can we do about work share, what can we do? We've put together workshops, we've put together webinars, and we've been running them for several weeks now with over 100 businesses participating in each of those webinars. So all of that information is also on our website, so employers can see that and let us know if there's something specific that we are not addressing. We will find that resource for them and help them.
Great, that's good news. So with that, again, they can log on to that same website you just said a few minutes ago to have for that additional information?
Yes, sir, yes.
Okay, great. Thank you very much. Another question I have is, what sectors of the economy can the public expect to likely be open first? Just wanted to see what your thoughts on that were.
Well, let me jump in real quick. Some of those that never shut down, Assemblyman, I'm not sure if you understand, in San Bernardino County, we have 5,066 logistics and warehouse type operations, and most of those never missed a lick. They may have shifted from a brick and mortar store to purchasing, but we're buying more online than we ever have. So our county has done an excellent job positioning themselves to have a long-lasting. We weren't totally reliant on the retail sales for our community, but we have a tremendous amount of logistics and warehouse. But out of that, on top of that, we have 587 manufacturing companies in our county, and those never stopped. They may have slowed down a little bit depending on who they were supplying. So there is a tremendous amount of jobs still going in those sectors. Now, we obviously, hit a real tough spot with our retail and entertainment and hospitality. They've been hurt tremendously. But, with the state and talking to the governor and some of the things that are coming up, we're preparing ourselves and had several meetings this week already about how to get our retail businesses back up. It's going to look different. There may be a different amount of people coming in the door. They may, they'll obviously have masks, but setting up so that we can supply all those type of businesses with the guidelines and vision for how they're going to serve their new clientele as they're coming back and being opening. So I think that's where you're going to see the next bit is in our retail. Our car dealerships are, begging to get open. So that's where we've started right now, and then we'll move on to those next steps.
Okay, great. Good information. Another question, is there a website that residents can use to find updates about the process of reopening the economy in the county?
Well, Sandy or EDD, or somebody from economics.
I'm reopening in the county. I'm wondering, I know our legislative person is on the line. I don't know if it's specifically listed there. I know that we have been putting out press releases. I'm actually looking for that right now, Assemblyman. I will get that back out to you.
Okay.
If there is a direct website, I will get that back out to you so that you can share it with your constituents.
Okay. That's fine.
You can find it on the. I'm sorry. You can. Hello?
Yeah, go ahead. I'm sorry.
You can find it on the SB COVID-19 webpage on our COVID-19. We have a COVID-19 webpage, and the information as we're developing it and it's being released, you'll be able to find it on the front page of that sbcovid19.com page. The Board of Supervisors is currently in conversations on how we can potentially safely reopen the economy. as those conversations and as we release guidelines, they will be available on the sbcovid19.com page.
Okay, great. Yeah, I was just going to mention that as well for folks. For more information, once again, covid19.ca.gov has more information regarding the opening of the state and the phases in the process. With that said, some questions on unemployment. One of the questions that was brought to our attention as well is, what steps has the EDD taken to remove barriers in processing unemployment claims to get money faster to the people? Maybe Sean, would you know?
Absolutely. It's a very good question. So right now, I think I said in my earlier comments, the EDD has taken a number of steps to help remove barriers to processing those claims. You can actually see on their website how many claims they're processing per week, and it increases substantially. But just to reiterate, so they have hired additional staff and reassigned other agency staff to begin processing those claims. They do have longer hours into the evening and have extended them to the weekend. They're also enhancing online services for individuals, adding more self-help options, and they have opened up a general hotline.
Okay, great. Another one, are parents who miss work to care for their child due to the school lockdowns eligible for unemployment insurance?
We can't provide a specific answer to that. EDD will take those as a case-by-case basis, but in general, yes, they are encouraged to apply. Okay,
great. How about self-employed or independent contractors? Are they eligible for unemployment insurance?
They are, Assemblymember. As of April 28th, just 2 days ago, they are eligible. The Pandemic Unemployment Assistance Program is accepting those applications. It's the same application you would use to file for unemployment insurance benefits. So please go to the main EDD website, and you'll be redirected there.
Okay, great. And then on that note, where can a person go to learn more about retraining for unemployment? Would that be the same website, or is there a different one? Would you know on that?
Assemblymember, I'm not sure that the state is providing exact resources through EDD for retraining individuals. They have conducted a number of surveys where individuals do expect to return to their places of employment post-pandemic. But if there are folks who need individual circumstances, I would recommend that they give your office a call.
Okay.
Assemblyman, this is Cindy Hansen. I could jump in to tell you that is what the Workforce Development Department does have funding to help for any kind of retraining. If it's just the job is changed when they come back, or they're getting they need retraining for a different type of job, that's absolutely the resources that we have there.
Okay, great. And I think if I heard as well, maybe the community colleges in our district are also offering services about retraining for unemployment, so that maybe that's another avenue where folks can go to the local community colleges in their districts, pretty much here, Chaffee College or Mount SAC, and we'll go from there.
Yes.
Okay, that sounds good. A couple questions on public health. One of them was, how long can we expect COVID to be a major threat to public safety?
This is Dr. Sanchez. I can answer that. Right now, we expect that we may have a small surge, again, probably at the end of May, but not as great as we thought. As the weather heats up, we're probably going to see a lot less of COVID-19, but we might see it again coming in the fall, especially in the winter, especially if we haven't developed a vaccine. Right now, the anticipation is that the vaccine trials are going quite well, and we might be able to get a vaccine going sometime in January, early January, February.
Okay. And on that note as well, another one got posed to me. What's the status of our healthcare workforce right now? Is there still a shortage of workers, and if so, which providers specifically are we having a shortage, if there is one?
Because of the shelter-in-place orders that were placed by the governor early on in California, the surge that we anticipated has not really developed that much, especially here in our county. We did start asking for volunteers But since we haven't had any surge, we really haven't needed anyone at this point. Our volumes in the emergency rooms in our hospitals are right around 50 to 60%. So slowly, especially in the middle of May, some of our hospitals are going to start to reopen to non-COVID-19 patients in terms of surgeries and specialty care that's been delayed. So that's going to happen. But right now, we don't anticipate any need for any more healthcare workers at this point.
Okay, great. And Dr. Sanchez, another question. If stay-at-home orders are relaxed in the coming weeks, do the elderly and disabled still need to take extraordinary precautions to avoid COVID?
Especially as the stay-at-home orders are relaxed, we actually have to be very diligent about continuing to practice social distancing, continuing to do the face covering and washing our hands. The virus, although we may see less and less cases during the summer, there's still going to be hot spots. And once it comes into the fall and the winter, we anticipate that the virus will come back. So we need to be very diligent to continue to practice those shelter-in-place orders as the governor continues to enforce. We need to continue to protect ourselves and protect our loved ones by practicing social distancing, by face covering, and washing our hands.
Okay, thanks, Dr. Sanchez. It's very informative, and I want to thank our panelists for joining us today as we start to near the end of our discussion. As we wrap up, I'd also like to share that on May 2nd, from 8 to 12 noon, I'll be partnered with the LA County Supervisor Hilda Solis, Pomona Mayor Tim Sandoval, Councilwoman Nora Garcia, Councilmember Victor Preciado, and Water Board Director Carlos Goitia to host a food drive to help families during these difficult times. That will take place at Washington Park, located at 865 East Grand Avenue, Pomona. Should you have any questions, please feel free to reach out to my office at 909 area code 902-9606 or my website at a52.asmdc.org. You can find information on my social media as well. With that said, that concludes our call for today. I want to thank all the panelists for participating in this town hall, and thank you, the audience, for calling in. Once again, if you need any assistance or have any questions, please feel free to contact my district office at 909 area code 902-9606 or on my website. Stay safe and have a great rest of the day, and we'll look soon to get through this public safety health emergency. And take care, and once again, thank you for joining us today. Thank you, and goodbye.